University Hospital has achieved the highest level of stroke care certification.
That's right. And with more on what this means for patients, we have Dr. Reza Behrouz, and he's here to explain a little bit more. Doctor, thank you for joining us this morning.
Thank you for having me.
So tell us first, let's start with this certification. What exactly does the certification mean?
Well, certification basically means that we provide the highest level of stroke care in the community, meaning that we go above and beyond just providing the IV treatment. We can actually go in there and surgically remove clots that block an artery that deprives brain tissue of blood, which leads ultimately to a stroke.
And who can be affected by stroke?
Anybody can be affected by stroke, anybody from children all the way to the elderly. But generally the peak age is from age 55 to 75. If you have certain risk factors, that could definitely increase your risk for stroke.
And when I hear about stroke, I always hear the word that you just mentioned. You talked about a blood clot. So it sounds like blood clots are not only life-threatening, but how would you know if you had one or if you were at risk for a clot?
Well, there are certain risk factors that put you at risk for stroke. For example, if you smoke, if you have high blood pressure, diabetes, heart disease, high cholesterol, these essentially increase your risk for stroke. But the best way to recognize a stroke are the symptoms, which may not be. A few people in the society, in the public, know about what symptoms are, what stroke is, and what symptoms are specific to stroke. So a mnemonic has been created to help raise awareness of at least the basic symptoms of stroke, and that mnemonic is FAST. F stands for face. If you see any asymmetry of your face, if you see particularly in the lower part of the face, in the corner of the mouth, if somebody tells you that your face is not, the contour is not the same, you can look in the mirror and see and confirm that. A stands for arm. If you feel that one arm is weaker than the other, the way to demonstrate that is to perhaps extend your arms and see if one drips down.
Sure.
S stands for speech. If the speech is slurred, or you notice that somebody's speech is not making any sense, it's garbled. And time, of course, stands for T stands for time, which is to remind you that if we act fast, there's treatment for stroke.
And time really is of essence. You have to act fast to get the best treatment and really prevent any more damage. Is that right?
Yes, of course. Every minute that passes by, when somebody's having a stroke, about 2 million nerve cells are destroyed.
Wow.
So you definitely want to, if you suspect that somebody's having a stroke, you have to call 911 as soon as possible.
And I've actually seen viral video of it. It actually seems like there are folks out there that suffer from stroke. They usually do have the telltale sign, but is it possible to be really subtle? Is it possible for somebody to have a stroke, but you wouldn't see the droopy face, you wouldn't see the problem with the arm?
It's possible. That's what makes stroke challenging. Not only it can be very subtle, but generally an individual would feel that something is not right. So if you ever feel that way, there's no harm in calling 911 and coming for an evaluation to the emergency department.
And for people who do smoke and maybe have high blood pressure, they're more prone to get strokes. What can they do to maybe prevent that? Exercise, good diet?
Yes. Well, first thing first is that you have to put the cigarettes away. The second thing is visit with your doctor regularly and make sure that your risk factor, which is diabetes, high blood pressure, high cholesterol, these are taken care of. If you do not exercise, you should start at least 20 minutes 3 times a week. Diet should be modified to a low cholesterol diet, low fat, and at least 5 servings of fruits and vegetables can decrease your risk for stroke.
Okay.
All right, and where people can get more information?
They can go online at the American Heart Association website or University Hospital website, UT website. There are good information regarding how to respond to if you suspect somebody's having a stroke or you yourself are having a stroke.
Great, thank you very much.
You're welcome.